All right, we are good to go.
Okay, I'm going to call the meeting to order since we do have a quorum. And the first thing is to read the script for a remotely conducted meeting, which I will try to summarize. As a preliminary matter, I'm Mary Ann Easley, Chair. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. So when I call your name, members, can you please say yay? Allison.
Yay.
Bob.
Yay.
You're here. Arlene.
Yay.
You're here. Nancy.
Yay.
And myself. Okay, thank you. Staff, when I call your name, please respond in the affirmative. Jericho.
In attendance.
Laura.
Here.
And Sherry is our speaker today, and she is on the call. So thanks, Sherry. Good afternoon. This open meeting of the Council on Aging is being conducted remotely pursuant to Chapter 20 of the Acts of 2021. Ensuring public access does not ensure public participation unless that is required by law, and this meeting will not feature public comment. For this meeting, the Council on Aging is convening by video conference via Zoom app as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to screen share your computer. Anything that you broadcast may be captured by the recording. Please remember to mute your phone or computer when you're not speaking. And please remember to speak clearly in a way that helps generate accurate minutes for our secretary. I think that's it for the script. So let me move on to the next item, which is approval of the agenda. Can somebody please make a motion to approve today's agenda?
Bob will move it.
Allison second.
Thank you. And I have to go down the list for approval. So please say yes or no. Allison?
Yes.
Bob?
Yes.
Arlene?
Yes.
Nancy?
Yes.
Mary Ann, yes. So that's unanimous approval of the agenda. Next is approval of the meeting minutes of our last meeting, which was November 2nd, and you should have received those in the last day or so. So I need somebody to make a motion to approve those minutes.
Bob will move it.
Thank you, Bob. Is there a second?
Allison.
Thanks, Allison. Are there any comments besides mine? Because I have a few minor comments that I want to pass on to you, Arlene, as our secretary. If you don't mind holding these up, there's nothing substantial here, but I think these were dictated. So some of the words came out as different words than you intended, I think. And I just like to make a few corrections since this is for public consumption eventually. So if you don't mind on this, I'll go for a vote of approval with these very minor changes that won't change the content at all. That's okay with everybody.
Bob will move it.
Okay.
Nancy second.
Okay, so I've got to go down the list again. Allison?
Yes.
Bob?
Yes.
Yes. Arlene?
Yes.
Nancy?
Yes.
And Mary Ann, yes. Okay, thank you everybody for that. Okay, now that we've dispensed with all of that admin, I'd like to welcome Sherry Hunt to our meeting today. Sherry's the director of Elder Services of Nantucket, and she is a lifeline to so many seniors on Nantucket who, many of them in dire need. So I thought it would be really great to have her here. Actually, it would be great if we could have you about once a year to bring us up to speed so that members of the Council on Aging are aware of all the programs that are available to seniors. So I'm so glad you're here and that you're going to give us a summary of all the programs going on. So thank you and welcome. And I'm going to turn this over to you.
Thank you for inviting me. I'm familiar with, I think, most of you, but in general, for those of you that are not familiar with Elder Services, we are the federally designated area agency on aging. We are also the state designated aging service access point. We are also the Aging and Disability Consortium for the 3-county area. I represent mainly the Nantucket office. I've been here in this position 22 years. So I'm very familiar with many of our seniors. We are a private nonprofit, and we provide assistance as well as advocacy for seniors and their families in this particular community. We also service the Cape, all of the Cape and the Vineyard. We were founded in 1972, and we carry out the mission of Elder Services in the following ways. We provide clinical services and community services. So in the community services, we include the home care program, which is providing services to elders in our community that may be in need of shopping or personal care. All of these things are done by financial and need criteria. So it is somebody that needs to be eligible to meet the predetermined criteria. We deliver Meals on Wheels, and we also do the noon meal at the Salt Marsh. I believe we have 16 congregate sites across the Cape. We do all the long-term care screening, which is a nurse that comes into our island home and determines the eligibility of a person to qualify for Mass Health coverage to pay for their stay at the nursing home. We also use the nurses to screen people in the community to determine if they need to enter the nursing home, if they're going to meet the criteria for the state programming, which is Mass Health. Protective Services is also under us. We investigate all reports of abuse, neglect, financial exploitation, as well as self-neglect. If we can be allowed into the home, and every elder still has the right to refuse to allow us into the home. So there's always that question that comes back from the community. Well, I called and, I told you Mary Ann was, not dressed properly and wasn't feeding herself, but Mary Ann said, no, thank you. And her doctor was able to tell us that Mary Ann's capable of making her own decisions. So that is going to end that particular claim, unless we are able to determine that Mary Ann cannot make good decisions for herself. There's a family caregiver support program. We do provide some funding here to palliative and supportive care to run their family caregiver support program. There's also a family caregiver support program based in South Dennis that will work with you by telephone. They may come here, but in my time here, I've not seen them come over. I think they've been able to deal most effectively by phone. Let's see, we do provide community grants, which I'm sure you're familiar with. Your grant to do the in-home sort of upgrades and things people would need for safety. It is from a grant from us, I believe. Am I correct, Mary Ann?
Yes.
Correct.
So we also do the long-term care ombudsman program, which is someone that comes into the island home unannounced, meets with the residents, and can look into and investigate any claims of a problem that we can help resolve. We also we look at the conditions of the home, make sure the residents are getting the appropriate treatments. Mature Workers Program. It's a program that sort of helps train people, elders, to go back into the work field. We've never been successful here because of the financial guidelines, which are set by the federal government, I believe. Most people here tend to have a little higher income than sort of across the country. So although we've tried in the past, we've not been able to fill that. Money Management Program is a volunteer-based program where we meet with elders in their homes and help them pay their bills, manage their checking accounts, provide a budget, help them stay on task with, being sure that their fuel doesn't get shut off or their phone doesn't get shut off. Those programs, again, are all volunteer-based. We have no money management volunteers in this community at this time. We have a volunteer resource center that's based in South Dennis, and they process all requests for volunteers for all of our programs. And all of our programs require an application, a background check, a CORI, positive CORI. So all of our Meals on Wheels drivers, all of our congregate volunteers, anyone working in this community has been background checked. Information and referral is also another big piece of our agency. It's based in South Dennis, but we also do quite a bit of it out of this office, more on a local basis. Information and referral can provide information to the caller and direct them to places that might be able to help them, as well as putting referrals into our system for someone that's in need of home care or Meals on Wheels. And then it gets assigned to a caseworker who then goes out and meets with the elder in need, and they together determine that they're eligible and then provide a plan to move forward. I think that covers pretty much all of our programs that we're able to offer at this time. I think a lot of people are always interested in what we do here. So I threw together a few numbers. For November, the Meals on Wheels program delivered 706 meals. We served 340 at congregate. We took in 5 telephone calls looking for information on Meals on Wheels. We took in 3 volunteer inquiries on how to volunteer for us. We did 1 training for volunteers. The current cost for meals on our programs, both programs, is $15.85 a meal. And we pay $8 per frozen meal, which we offer for holidays and weekends. Currently, the census, so to speak, for Meals on Wheels is 37 seniors, and home care services 14. If there's anything else I didn't cover or questions, please let me know.
I will mention I went to my final Elder Services of Cape Cod and the Islands Board of Directors meeting yesterday. I've been on the board since 2018. Nantucket should have a representative. I guess Laura will get a notice when nominations or whatever are due. But there are subcommittees, as well as being on the just on the regular directors board, finance,
Nutrition.
Really, there are several great committee appointments as well. I was on nutrition as well as ASAP for a while, but we have some momentum now going when it comes to caring for our seniors, and someone from this board would be a good fit. A lot of the other boards have the directors of the actual senior centers on the board, because they really can oversee everything going on in the senior center. Nantucket, Laura is not a director. I don't know why we don't have a director. Laura, do you know why? But anyway,
isn't Jericho the director?
No,
No? I thought when they regrouped and took away the position, it all then went under sort of Jericho's position, which he wasn't in at that time. But yeah, no, they did away with it when
Linda
Pam
left.
Merriam, it was Pam Merriam.
Mhm.
And Pam Merriam oversaw the Island Home, I think Council for Human Services, and the Salt Marsh, and that was considered the director. I don't know when that might have changed.
So it changed when they restructured the town, and then I was hired. And when I went to go for my program coordinator certificate with MCOA, Pam asked them if I could be a director, and they said no, because I do not do anything with Munis. That's Ann Medina.
Yeah.
So I'm just a program coordinator and not a director. That's the way it is.
So,
Oh.
so what does Ann do?
She's
Muni?
like she's the office administrator. She does all the Munis stuff. She pays all the bills, all that type of thing. And then Jericho does all the stuff with the budget. So a director would do all of that. They would go to the town meeting, get budgeting, pay all the bills, and then have a program coordinator probably under. Like Ginny was the assistant to Linda Roberts. Some reason the town restructured everything, the year before I was hired. And when I was hired, it was program coordinator. So
they don't have directors or department heads on anything. They get restructured everybody. Because I was a department head with the zoning board. They got rid of all that, and there's the planning director. That's the only director I know of, because the Concom doesn't have a director. The ZBA doesn't have a director. They're all working out of other offices, under other offices. So
Yeah,
there's no point in that.
I'm just comparing us to the other Council on
you
Aging's.
should never do that.
Don't do
Allison.
that.
Well,
We
it's-
are all, if you've seen one senior center, you've seen one senior center.
right. Well, but
We're all completely different.
And they're all
Yeah.
created under different
But, I can see how somebody that was involved on that level could, could contribute a lot more than I've been able to contribute to the, to the board of directors. But anyway, we need to recruit some more Council on Aging members, and in May is when they decide on the director for the board. So I'm just putting that out there for you guys, because you'll learn a lot. Okay.
Thank you.
Allison, I have a question. What does it look like as far as commitment and energy and all that? Like,
There's a once a month board meeting. Before Zoom, I used to go over, and they pay for, transportation, and they have a lunch there. Your subcommittee meets at 11. The full board meets at 12, and then the meeting is generally over by 2. I did put the new website link in the chat box, the brand new website as of September, and it's really, really, really good. Informative, easy to, we ask Sherry all these things, but, now, if you have a question about, protective or whatever, it's easy to find it, on the internet. But it's been really interesting, and it's a really solvent it's a really solvent board, strong leadership. Lots of people have been with them for a long time, and that says a lot about an organization. So yeah, we're really fortunate to have Sherry, and I hope they're taking good care of you.
Thank you.
Yeah.
Sherry, I have a question, because I think that Allison has mentioned at a previous meeting that you don't have a waiting list of people. So pretty much people on Nantucket, elders who need services and want them, are getting them, which is different from the Cape, where there are waiting lists. Is that true?
That is absolutely correct. I was in a meeting recently with Allison as well, and I spoke about the fact that referrals for this office have dropped considerably since the hospital has changed their venue. I used to get basically I almost got something every week from a discharge planning standpoint. In other words, every time someone's in a hospital, the social work team looks at what are these person's needs to safely return to the community. And the doctors would call me directly. And then since we've changed to more of Mass General's way of thinking, I'm not getting those referrals. They refer them to a young lady that's called I've forgotten her title, some sort of a case manager, but she doesn't see people. She strictly calls them. And so she determines by a phone call she thinks I need to be involved. She will call me, but those are becoming few and far between, to be very honest. So there is no wait list. There's services available. It's just a matter of somehow someone getting to me so that I can help them determine what kind of plan we need to put in place for them.
Would it be family members, or what's the best source? How do you get the
any
best
source, Allison?
Yeah.
Any source, your neighbor. You notice, again, though, I have to go back to the person has to agree. The person has to let me in, which is why in some fashion, I'm a bit disappointed that the hospital's new way of handling things is phone calls. I can talk to you on the phone and think everything's wonderful, but that doesn't mean your house isn't falling in around your head, or you're not bathed for the last 3 months, or you don't have enough food in your refrigerator. So, I encourage all of you to encourage people in the community. If they have a concern about somebody, call me. Let me try to reach out and see if it's not something that I can interest them in, that they qualify and I can help them. If it doesn't get to me, I can't help them, much like anything else in the world, if you don't know about it. But
yeah, so it takes a little hand holding sometime by someone who's aware of the services and aware of the person who needs them.
Yeah.
So if that can't be a doctor, who can it be? So
I don't know. Children, your children can see that you are in need of help and give me a call. A neighbor. Yes. But you see what I mean?
Yeah.
It's making the call. That's what's important. Encouraging people to reach out and let us try to help. Maybe they don't need home care, but maybe they need Meals on Wheels, and then Mark would get involved. That program right now is pretty strong. And again, there's criteria to meet, but Meals on Wheels is not, the ruling's not as strict as home care. Home care does have to follow the state guidelines.
And so, Sherry, is the above income, does that work for home care too?
It does. Mm-hmm. It doesn't give you, I have to stay within a cap for spending set by the state. There are programs for much lower income people that I can expand upon. I do not have the ability to expand upon an over income. It's a sliding scale from 0 to 100% of the cost. We don't provide services directly. We have contracts with agencies to provide the services that I determine, and then I order from those agencies to deliver. So if I decided Allison needs help with a shower twice a week and Allison's agreed, then I'm going to ask the 2 agencies that I'm working with, can either one of you provide an hour twice a week for a shower? Then a nurse goes and sees Allison, she sets up the care plan, then the home health aide, nurse's aide comes out with a nurse from the agency and they review for safety and be sure that they're comfortable with what plan we've put in place. And then that person comes same day, same time for the rest of the time that it's needed.
It's a great program.
It is. It is.
Sherry, I also want to just clarify, you mentioned that you have 14 clients for home care and I think 37 you said for meals.
Correct.
So does that mean that you have a total of about 50 unduplicated clients right now?
Several of the home care folks would be also receiving meals, but yes, that's
Oh, okay.
unduplicated, but it is unduplicated. I counted them separately. So that is, it's a total of 50 odd for both programs.
And do you have any sense of the number of people who might also be in need but are refusing it? Do you have any
There are
estimate?
several that I'm aware of in the community.
Hmm.
But without the doctor's
Very nice.
support and the doctor's ability to tell me the person definitely needs services but isn't able to make a decision on their own, there really isn't any way to change that unless something happens, which is kind of sad. But it's very difficult for a doctor to want to declare someone to be not competent. It can involve court action. It can involve a lot of things that are difficult. So, but again, I think by speaking with you all, it gives you a takeaway that you might think of someone that you hadn't thought of before who might be in need of our help, that you could, or, 6 months down the road, something will strike you. Oh, wait, I can call Sherry.
Or a
So,
friend's father, or, you hear about, it's the same sort of with hospice. No one really wants to be a hospice client, and no one really is dying to be an elder services client. But if it can help them, and, you can.
do you know what the best answer is I get every time, Allison?
What?
I'm not old enough. That's for
Right.
old people. That's for old people.
So the stigma.
Uh-huh. For sure.
I also want to make a plug for Meals on Wheels, just because now that I'm a waitress at the congregate lunch once a week.
And thank you.
Sometimes I hear people say, oh, the food is terrible. I want to absolutely overcome that because the food is wonderful. It's all prepared by Kitty Murtaugh, and it's delicious and so inviting that, at the lunch, it's the same thing. Meals on Wheels people get the same lunch as the congregate lunch. Fantastic food, delicious food. So if somebody says it's not good food, maybe they had one bad experience, or maybe they just didn't like what they had that day. But overall, it's really incredible food.
Well, thank you. I appreciate that.
I second it.
Kitty's does a nice job for us. I have no complaints at all. We've been blessed to have them.
I think that we pay about $10 more per meal than anybody on the Cape.
Yes, we do.
So,
but they were the only ones that stepped up when the hospital sent letters to all the Meals on Wheels clients and said, yeah, sorry, we're not going to do this anymore. Instead of sending them to me, they sent them out to everyone at the same time. And we were scrambling. I don't know if any of you remember that, but we were we were in a really bad place. Trying to figure out if we could fly food over from the Cape. It was terrible. No one stepped up. And then John stepped up at the very last minute. And it's been a very good working relationship for a very long time. So.
Well, the meals are wonderful.
Thank you.
Do other Council on Aging members have questions for Sherry or comments?
Sherry, I have a question.
Sure.
It's Arlene.
I remember you.
You
I
do?
remember Ruby very well.
Yes, my grandmother.
Yeah.
Yeah, she was at the Landmark House for the longest time.
Mm-hmm.
My question is would it be helpful to do a PSA for the awareness part of elder services to run on social media? And when I say a PSA, I mean a very thoughtful, put together multimedia presentation that is very gentle, like something the ad council would do. That's a message that's just simply targeted for the local community.
It's possible.
Has that ever been done before?
Well, they've just recently started. We now have a Facebook page. We now have a presence on Daybreak. They've been publishing, and so has Nantucket Current. Mm-hmm. So I'm feeling like we're slowly getting out. We have a new CEO who's much more open to working social media than our previous And I think we're slowly coming out into the social media presence. And all I can say is at this point, I'm just kind of watching to see what it actually brings to us.
I think because there's a new website. I mean, the old website was impossible to navigate. I would have never have sent that to people who were interested in learning more about elder services. But since there's now a website that answers a lot of questions, I think to publicize that would be in a PSA would be great, because it would not send people just calling Sherry. It would send people to the website so that they could then see what resources are available and then be in touch with Sherry.
Right, which is what a PSA would do.
Yeah,
it would drive people who are interested in it, and particularly if it's, appealing to them or speaks to them in some fashion.
Well, and even more than that, Arlene, I would think it would speak to the children of, because they're that's really the targeted audience anymore, is to get, I don't see as many elders. There are some who are on social media, but I think it's more the children of, grandchildren of, and that would be the audience to reach, for them to start looking at what's available for their mother, their father, their grandparent. So I think it might be something worth investigating.
Okay.
Other people who might have questions for Sherry? Or Sherry, maybe even you want to have questions. You have questions for us.
No,
Or recommendations for us.
I'm pleased to have been asked to speak to you. I really, I think that oftentimes people don't really know what we do. So this gives you an opportunity to look at what we do and how we can work together. One of the things I would love to see, and I don't know that the town would ever do it, but an outreach worker. I feel like that's something we're really missing in our community. And that could be a person who's out there doing that friendly kind of visit from the senior center, who's then going to identify people and say, wait a minute, this needs to go over to Sherry, or this needs to, they go out and they meet with the people within their home on a social sort of visit, and to sort of invite them into your senior center. And I know you have a large, Laura could speak to how many people your email goes out to, your activity email. Sometimes a personal visit goes further than an email, in my mind. I think we are able to see more and maybe understand more about someone's situation and be able to find some common ground that they might want to come to the senior center for a movie and stay for lunch. You give them information about the fact that the bus will pick them up and bring them. You can help them get the application done. There's a lot of things I find that you can do in person. And I see us moving away from a lot of that. And so that's just my plug. That I think if you looked at some of the positions in other COAs for a community outreach worker, it might be something you might want to look at.
Thank you for that suggestion. Yeah, very, very good suggestion that we should consider.
Well, you have to get the town. You have to get the town to fund the position. So,
at the current time, the only people who actually get access are the representative from the fire department, who goes in to check batteries in people's smoke alarms, and lately our handymen who go in to put grab bars in. Those are the two people who are currently invited in and can make observations and pass it along for sure. And maybe even we should think about them leaving behind some literature or something like that.
The fire department's pretty good about that. They generally will call me immediately if they think they see something amiss. They're very good at asking. And we only use a street address. We don't use names, just to find out if it's somewhere I'm aware of or involved in. So They are, Sean Mitchell has been incredible in that position. We now have Kevin Ramus. Kevin has now been appointed into that position. So we are working currently on getting lock boxes installed on the outside of homes for people who have lifelines. It's a project Sean and I started and then hadn't been able to finish, but we've determined now that Phillips Lifeline will provide lock boxes at no charge, and the fire department is willing to install them. Right now, they maintain a big, huge key box, and so they have keys to people's homes so that they don't have to kick doors in. It would be so much easier to arrive at a home, key in the code, and open the door. So that's it. That is a project we're trying to work on currently.
Oh, great.
I'm also in the process of getting my notice out for the, it's either the 19th or 20th year we've been doing Christmas dinner with the Sea Grill for people who are homebound, alone, or really unable to prepare a meal. Those notices will start going out tomorrow. And then we deliver all of the meals hot on Christmas Day. It was something that Robin and I put together. Like I said, it's 19 or 20 years this year.
Wow.
Yeah.
Wow.
And the Harveys provide everything at no charge. So I just always really try to ask that people be honest, that it's really something they need. We've run into some bumps over the years. But
do you need any help delivering those, Sherry?
Yeah, I'd be happy to put your name down.
Yep, put my name down.
You got it. I will be in touch as we progress. What I do is just like I do with meals, I create routes for depending on how many people we have needing food. And that depends on how many people you'll get. We all meet together at the Sea Grill at noon, pack up our stuff, and then go out individually and deliver to the particular route we have. I've been doing it for every year for 19 years. It's it makes you feel pretty good when you go home and you have your own family to go to.
Sherry, how many people would you say on average would that be a year?
We've done anywhere from 50 to 250. It
Wow.
really, yeah. We had opened it up at one point to the school, but it was pretty well disastrous. We had volunteers at homes trying to deliver food and they were having dinner, come back later. We're not home. Can't you come back at 6? So we had to stop. We don't do the school anymore. We only do the seniors. And I think, you know, the families in the schools have the food pantry and they have some other options if they're really in need. So I feel comfortable only working with the seniors at this point. Robin tried because she was on the school committee at that time. We opened it up to families in need. And some of them were so grateful, but there was an awful lot of volunteers who came back and said, I will never do this again. So we had to rethink it, sadly. I'm also working with the food pantry, trying to get elders that are heavily using the food pantry to take Meals on Wheels instead, which would help the food pantry be able to provide more food to families. I've been successful with 3 so far. I'm still working. Another fun thing you guys might be interested in is for the last 3 years, there's been a member of our community who has gone on Facebook and created a Secret Santa. So we distribute to our Meals on Wheels clients sort of a little flyer that says, you know, if you could afford something, or if there's something you'd like that you can't afford, tell us what it is. And I think we have 29 people this year that are getting a Secret Santa gift. So I'm always busy, but it's all with the help of the community. You know, the woman in the community does this. She collects all the gifts. They come in wrapped, and then she brings them back to me. So nobody knows who's getting them except me. So I try to think outside the box. I try to do things that I think will bring people from our community together with our seniors. I have the Congregational Church Ladies Union Circle makes a Christmas bag every year for all of our meals clients. The Girl Scouts are bringing me birthday boxes for clients. So on their birthday, we will be delivering a box made by the Girl Scouts with little gifts in it. I don't know that we can do that in other areas that are much bigger, but for us, it works.
Sherry, this is Bob. The Rotary also has a birthday box program that we started with the Boys and Girls Club and are moving out from that.
Oh, wow. I'm not aware of that one.
And it's a whole cake pan with all the makings inside of it, balloons and candles and everything else to have a birthday party.
That might be tough, though, for some of my elders, Bob. I don't know if they'd be able to prepare a cake.
Okay.
Good thought.
I just throw it out there.
No, I never had heard of that. That's wonderful. What the Girl Scouts do is usually little, little pad, and a little notepad, a pencil, maybe some pocket tissues, very small items, but the girls actually purchase them and make the boxes and make cards. So that's something we've always welcomed as well. But if you think there's a way for the Rotary to join hands with us, I'd be more than happy to talk about it.
Sure. You're over at Landmark House, aren't you?
I am.
Did I meet you yesterday when I was over there with NHA?
Yes, you did. I took the DVDs from you. I'm trying now to work on getting some of the Landmark folks to have a popcorn and DVD night. So
good.
Anybody else? Anything I can answer, or anybody have any suggestions for me?
Just a comment, Sherry, I think you're doing an amazing job.
Thank you. I appreciate the support more than you know. And
Thank you, Sherry, for taking the time today too, so that we know more about what you're doing. And I think we all know where to find you if we have any ideas. So
I hope so. And I'm happy to come back every year, Mary Ann. Just let me know when.
And I've already told you, Sherry, that you're never retiring.
You hush, just hush.
Oh, you never retiring. You live right behind me. You're never retiring.
There are days I think about it. Trust me.
Don't think too hard.
Yeah. Thank you, Linda. All right, guys, I guess I'll sign off. But again, I appreciate your interest.
Wonderful to
Thank you, Sherry.
Bye now.
Thank you, Sherry. Goodbye.
Bye.
Getting back to our agenda, the next report is from Jericho. So Jericho, are you still with us?
I am indeed.
Oh.
Updates from my end, specifically senior focused. We are working along with the CFN funded grant, like the senior projects. I think they're calling it a work group now. We've got Heather continuing to go into Salt Marsh to do some basic health screenings. We're doing our once monthly tech clinic down at the Salt Marsh as well, which is going over quite well. I'm hoping to get another person who's willing to do that so we can double up on that. And also maybe get a Mac specialist, because that's not my strong point. Other than that, it's been a lot of the sort of year-end administrative stuff for us, specifically on the grants that we're working on. We should have the payment issued for the last one for Bill Freed, should be in the mail with the next warrant. And I'm waiting to hear back from administration on that signed contract, Marianne. I've been poking them every 2 days. I'm trying to think what else there is to report on that.
What about Memory Cafe?
Memory Cafe did get an initial tranche of rural health equity funding. So we've gotten them some seed money that should tide them over until the end of this fiscal year. They have applied to CRC for additional funding to support them for the remainder of the year. I will not know how that's going to go until after the grant process is over for that, but we have another stream of revenue. So we got a rural health, or it was originally called a rural vaccine equity grant from the state, which was a really innovative new way of distributing certain monies that were released from the federal government by the American Recovery Act. And basically, we got an ongoing grant for 3 years to spend basically doing anything we want to that will improve health outcomes in a rural area. Part of the ways that we started spreading that money out were things like the Memory Cafe. We've got some behavioral health stuff. We're working for it. And we're going to try and slice some of that money off also to go for a basically a landing page for all of the behavioral health resources on the island. So similar to our network of care site, which is a directory, ostensibly a directory of all of the services, all human services. God, that sounds so silly. All HS services that is so a central place online to have everything on there. And we're going to try and build it out so that it has a calendar of volunteer opportunities. Additionally, the town authorized a new part-time employee for me who's going to be a volunteer coordinator. So basically finding opportunities to volunteer around the community, sharing them in a centralized place, and trying to have sort of some scheduling stuff attached to that as well. I imagine both Sherry Hunt, the Salt Marsh, and everyone else can probably find some use for that, so we can kind of get a centralized place to organize volunteers for necessary island work. After that, yeah, I mean, that's a lot of the stuff that I'm doing right now is less service facing, unfortunately. Although hopefully by the start of the new year, we're going to have some more programming opportunities down at the Salt Marsh.
I just, again, have a few more questions about the Memory Cafe. So yeah, the funding you have is for starting it next July?
So the initial money that we freed up from this Rural Health Equity Grant is going for them to prepare secure space. And I think they're securing a facilitator with that money, at least part of it. I don't believe they're planning on starting memory cafes until the CRC funding comes through, because they had
which will be what time?
Which will be end of fiscal year this year, so June.
Okay.
End of June, start of July. Usually the first quarter is dispersed immediately in June. I think June 1st is when the checks may go out. I would not expect the Memory Cafe to be up and running and having guests until after that time. I do have to check with Brian and Rachel on that as well. Rachel used Sherburne Commons as the 501c3 to receive this grant money, because the community school, which is doing some of the administration works, 501c only deals with child-based issues. So Sherburne Commons stepped in. I believe they will still be hosted at the community school downtown. Did that?
And you know, I have been talking to Charlene Thurston, trying to interest her in being the facilitator. So I think that would be a really incredible score for a Memory Cafe. So that would be great. There is some private funding that could be available. I know that she's working on that to hopefully get it open before summer, because summer's not a great time to start something necessarily. And like Elder Services, it's going to take, for the Memory Cafe to be successful, it's going to have people that attend it. And similar to not knowing what elders need more services, people who have Alzheimer's or related dementia aren't usually the first people to step forward. So, people that that have Alzheimer's, and as you hear something, you hear about new people every day. Well, not every day, but so it's going to be helpful for us to be able to do some outreach and encourage people to take advantage of the Memory Cafe if they like it, once it's up and running, because unless people go, it won't be successful. So If you're thinking caps on.
Does anyone have any questions for me about anything that's going on at the current time? Anything town related or that I might know?
Usually, Jericho, you give us updates on COVID wastewater treatments. Anything on that?
We've gotten the last two. Okay, to properly explain this, will take a half second. Is that so? We've been collecting the BioBot samples since July 20, I think summer 2020. Last fall, or earlier in this fall, actually, in the end of the summer this year, CDC changed how they collect that data. And BioBot, which is the company that does it, debuted a new metric that's built in. So I cannot compare any results from before that period and after that period. If you remember what these wastewater tests look like, there's that jagged line graph that goes up and down that gives you how much COVID is in the water as a function of how many people are getting sick. So I can't compare where we are now with where we were a year ago or 2 years ago, but all of the COVID infections we've seen since the end of summer have been a little tiny jagged line on this wastewater result. And the last two have spiked directly up. So I would say that this is, there are probably more COVID cases around now than at any time since, at the very least, this summer. Additionally, there are 3 times as many influenza B positives as there are COVID positives registered in MAVEN, which is the communicable disease database that the state has. And we have, so there's an enormous amount of flu going around, a couple of nasty strains this year. And then there is also RSV, which is an additional respiratory virus that is not as easy to test for. So we don't know how many cases there are, but it's a fair bet that there's a lot of it right now. So basically from now through the holidays is about as your chances of getting infected in the next month to 2 months is about as high as they can be. We're actually issuing an advisory. I believe Florencia has put it up, but we're issuing an advisory again to mask whenever possible. Everyone knows the situations in which they should mask up, but we're on I think we're on BF 1.6 right now. So we're like 4 or 5 sublineages out from where Omicron started. So for the next 2 months, like for example, today when I went into jury duty, the first thing I did was throw my mask on. And I think that if you're in a situation where you are indoors with somebody else for longer than maybe 5 to 15 minutes, it would be a good idea to mask up. So unfortunately, I can't tell you where we are locally in the context of all of the pandemic. But since we've switched to this new reporting methodology, this is absolutely the highest risk level that I have seen in about 4 months. So take your qualitative assessment of the people you know that have gotten COVID, and then realize it's a little higher than that is. But that said, still no primary hospitalizations and no medevacs as of the last update from the hospital. So there are more infections. There's even less hospitalizations or required interventions. So sorry to not give you guys great news on that front, but that's basically where we stand.
And Jericho, how does this affect the Salt Marsh and all the programs there?
So basically we have confirmation that everybody in the Salt Marsh is vaccinated and everybody in the Salt Marsh is boosted. If we see some infections through there, or if we see people who are in that circle going positive, then I may consider a mask mandate indoors. But we've already had 2 or 3 chains of infection through Salt Marsh affiliated people. In the last 2 or 3 months, there's been much of the people who are either frequently there or are members of NCEA have come down with COVID too. So, you know, I'm genuinely unsure whether or not a mask mandate only in the Salt Marsh is going to improve the safety of my residents. That said, if I feel the need to do it, I have been the only place on Nantucket mandating masks before, and I will be again if I feel that that is the safest solution for visitors to the Saltmarsh Senior Center.
Thank you.
No problem.
Are there any other questions or comments for Jericho? Thank you, Jericho. Nice to know what's going on, even if it's not all good news.
I think forewarned is forearmed in this context, and I think it's definitely good to be prepared.
Thank you. Next on the agenda is Laura, and we have your report, Laura, but perhaps you want to invite questions or comments from people on your report?
I would. I also just want to make sure everybody read it right back to right at the end, because our Council on Aging, Saltmarsh Senior Center, won second prize for the Mass Walk Challenge.
Wow, how did that happen?
Yeah.
Well, I asked them to send me the list of how many people. It's luck of the draw.
Wow.
We had 3 entries. And we got second place. And actually,
What do we get for it?
we got $500.
Okay.
So they want to know how we're going to spend it. So I'm hoping I can spend it the way I want, Jericho.
I got to get my cut first.
Just kidding.
What do you want to do with it, Laura?
I just found out yesterday or the day before. So I haven't even thought about it. And then I did get an email also that Jeanette Topham won the individual second prize. I don't know what she gets either, but that's pretty exciting. I was shocked.
I hope this is going to be in your newsletter.
I was shocked. So
Maybe we can spend some of the money on advertising for next year so we can get get a bigger group together, because that was a great program. We just didn't get on it in time.
it was. And it was lots of fun. I did it.
Yeah.
I thought it was cool. So anyway, I just wanted to make sure everybody knew that, because I think that's pretty cool. Any questions about anything? What's going on? Nope. Nope. Good.
Mhm.
All good down here.
Laura, I've got a question. How many people are new Saltmarsh? I mean, are you recruiting people, or how many people just sign up on a random month?
We've had maybe 4 new people in the past 4 or 5 months. I mean, they're not knocking our doors down, that's for sure.
Mm-hmm.
But I can tell mostly just of how many emails, go out for constant contact. So it's gone up a little bit, but nothing drastic.
I still think we need to promote ourselves.
Yeah.
Well, everything that they're doing in Current and Daybreak is fabulous. Yeah. They're really, really doing a great job. I don't know how much. The only thing that really picked up from that was Social Security. We've been booked out for months because anybody can sign up for that. That's not just seniors. And of course, it's definitely Medicare, Medicaid, but people lose their Social Security card, or they laminated their Social Security card. So we've been booked out for that. That's the only thing that's really picked up. And that's probably because of the new license that you have to get, although they just extended the deadline to 2025. So it'll probably slow down a little bit.
Those IDs.
The real IDs.
Yeah.
And I actually, now that I think about it, I'm going to talk to, at one point there was a public information officer at the hospital that I could communicate and I could give information to and receive information from. And I was wondering if we should get the probably most consistent way for us to figure out when people become seniors is when people go to their annual physical checkup at the hospital. So maybe getting an in there, letting people know that there is a senior center, here's how you sign up for it, might be an interesting way to try and get new people in. we'll see. Anything that has to do with NCH can be complicated.
Yeah, say the least.
Anybody else have any questions for Laura? Thanks, Laura. That's great news about us winning that. I can't believe it. We did so little publicity. So excellent. And thanks for the thoroughness of your report all the time as well. Much appreciated. The last thing on our agenda today is a wrap up of a few different things we've been involved in. And maybe we could change the order here a little. If Nancy, if you want to give us sort of a wrap up on what happened with the winter coat giveaway.
I can. We decided to extend it one further day. We had the opening on Friday for gathering all of the coats and sweaters and miscellaneous. Saturday was the giveaway, but if anybody remembers the Saturday of, was it Veterans Day weekend, the weather was terrible. We had monsoon, rains, winds. So that was a little bit of a deterrent. And we were open till about 2 o'clock, and the weather finally broke maybe about noontime. So we did get a few stragglers coming in, but we decided to go ahead because we had such a surplus of running it again Sunday from 9 to 2. And it was like, you know, giving away clothing. They couldn't have come in more multitudes of people. Great success that day. So we didn't have a huge amount of clothing left over. We did gather up what we had and we put it upstairs in the attic at the Saltmarsh Center. We thought we had a little bit more than we actually did left over. I believe we had 7 coats, which Marianne, you saw the multitude of clothing that came in. So to be down to, to just 7 coats, well, we must have had 5 or 6 clothing racks. It was very full. And I think we were down to 40 sweaters, but when you think that we probably had 400, so, you know, the amount of things did really dwindle down. There's a place on Old South Road. It's on the corner where the new development is in the Glowacki area. It's called the Painting Department. And they had advertised in last week's Inky that they were accepting a clothing giveaway, all the winter clothing, in addition to the chicken box. So without realizing how little inventory we had, we thought maybe we'll just rerun the clothing inventory and get rid of it. But there wasn't enough when we finally realized what was upstairs in the attic. So Daryl Westbrook went upstairs, grabbed what we had, and took it down to the painting department. And we are forever on their good graces list. They were so happy to receive what we had donated to them. So happy to know that it went not only for a 3rd day, but we sent it down for a 4th day to be, UPS just knocked on my door. So that was the good thing. And we didn't want to compete with other people that were offering clothing drives. I mean, it's kind of, you know, we're competing against each other. So glad to do it. And maybe next year, Marianne will have a little bit of extra help on the donation day. Marianne should work for a clothing department. She sat there with these piles of clothing that just keep coming in, and people were bringing huge bags and just dumping them. And Marianne, very organized, sorted everything according to sizes. She had tables all through the Saltmarsh, sorted the clothing according to the small, medium, and large, male and female, and very neatly folded. It took her the entire day. But we are very beholden to you, Marianne, for your diligence in what you did.
Well, I'm gonna, in my re-entry into the workforce, I'm gonna work for the Gap.
That's what we said. She'd make a wonderful Gap employee. Everything was very neatly folded. And we thought when people come in and start plowing through it, but it didn't turn out to be too bad. But happy we did it. We met a lot of people that were truly very deserving.
Yeah. I think it was a great success. A lot of people.
It was. Happy to do it.
Warm clothing, got warm clothing for free.
Absolutely.
Thank you for all of your work on that, Nancy.
Yes, well, great idea.
Huge amount of work on your part.
All for a good purpose.
I'm going to wrap up with just a few other updates on things going on. Our home modifications program, where we put grab bars and railings in people's homes, is going smoothly at the moment. And we've did 2 new people last month, and then well, actually the month of October, then in November, we did 3 more. We have a small waiting list, but the people on the waiting list right now are not responding to me. So I don't know if they've gone to Florida or if they're just involved in other things, but I'll keep pestering them. And I've started getting feedback from people, actually sending out a satisfaction survey to see how happy people are with the service or unhappy they are. I've sent out 7 of those questionnaires so far, and I've gotten back 3 and 2 today that I haven't even opened yet. But the first 3 that came back, they were just over the moon. They were totally satisfied in every category and praising particularly 2 of the handymen who've been doing the work. 2 of them are so enthusiastic about this job that they're doing. And it comes through on both the side, the handyman side and the client side. So people seem really delighted with this service. So we have a really great report on that this month, which is good. And if you know people who need grab bars, and if they want to get a personal endorsement, Bob Kucharvi got a grab bar, so he can even tell you how happy or unhappy he was. That's going along pretty well.
You have my review, Marianne.
Oh, okay. Has yours come in? Have you sent it already?
I mailed it the other day.
Oh, okay. I just probably haven't opened. I got a couple today that I haven't opened yet. So going smoothly right now. I also want to report on the fact that both Laura and I are serving on a committee that's headed up by Libby Gibson to look at the whole Our Island home and the new senior center. Something that's going to be in our lives probably for as long as all of us live. But anyway, things are moving along very quickly. And so I wanted to just report on a few things that we have done in the last month. The first thing is we had a Zoom call with the person who directs the Plymouth, Massachusetts Senior Center. So it's brand new. She had a lot of recommendations for us. So it's great to hear. And she's very happy to take questions even after that meeting. But probably the big takeaway for me was if you do a senior center, make it for seniors, not for everybody else, or the seniors will leave. And so that was the big message that I got out of that. The second thing is I want you to know that the land bank owns the property adjacent to the current Our Island home. And they actually have the waterfront, and they are in the process of coming up with a plan for developing that into a public park. So now is a good time if you have any ideas about how you'd like to see that happening. If our senior center winds up at the location of the current Our Island home, it will be right next to this waterfront park. So that sounds like a great idea. And they are in the early stages of planning that. Then we had a Zoom meeting with the Martha's Vineyard people who are building a new nursing home on Martha's Vineyard. And theirs is a little bit larger at 66 beds. And they are just in the process of doing their plans, although they've got all of the numbers together. They know where it's going to be located, which is adjacent to the hospital. They have not started fundraising yet, but they've done a lot of investigating. So the big message from that person was, do not do an institutional nursing home like we currently have, but do something that they call the greenhouse model, which is smaller. I don't know if we can actually do this, but it's smaller groups of people living together. Theirs will be 5 or 6 different pods, each completely independent, where 5 or 6 elderly people live in this pod, and they have their own kitchen, their own staff, their own everything. I don't know how that would work for us financially, but
Mary Ann, I know
Yeah.
that the drawings that they had done for Sherburne Commons before, when it was planned to be there, was the greenhouse model, and I don't think the town is going to go for that. But I
agree. It's expensive.
Yeah, and being a municipal nursing home, I don't think that the taxpayers would. I mean, that's a great model, but there is a Alan Atwood, who designed Fisher's Landing, is on Friends of Our Island Home board, and he's been working with Eisenstein, the guy who the town has hired, who's a great guy. But I don't think we'll be able to do the greenhouse model from what I've learned, but there are modifications, and something will come of it, I'm sure.
Yeah, I just wanted you to know that we've talked to Martha's. We're in conversation with Martha's Vineyard, and they're ahead of us for sure. And we may do something totally different, but that was the advice that they were giving us. I don't know if we'll take it or not. And the last thing we did was we actually went out and made a site visit to Sherburne Commons to look at the actual piece of land where the new Our Island home might be located. So, and a few of the people who currently live at Sherburne Commons came along with us and gave us, their concerns. They have plenty of concerns. So it was good to hear from them.
Mary Lou Quinn.
Hello?
Sorry,
I think that was an incoming call.
Yep.
Okay. And the last separate subject matter, which I just want to very briefly mention, is I did attend last month's meeting of the Center for Elder Affairs, who are now calling themselves Friends of the Salt Marsh, or Friends of Nantucket Seniors. I'm not even sure which. But I wanted people to know, if you go to the Salt Marsh and you're annoyed by the noise level and the reverberation in the main room there, they approved the installation of some kind of panels that would fix this problem, supposedly. So the problem in the redone Salt Marsh that people are complaining most about, which is noise, may get a solution very soon. They did approve spending the money to put these panels in. So I'm sure we'll all see how that goes. And that's the end of my report as well. So if anybody has questions for me or comments.
I have a comment.
Sure.
This is my last meeting of the Council on Aging. I resigned, and that was approved at the Selectmen's meeting. So Susie Spring has also resigned, Kendra resigned, I've resigned. And so we need to work on finding people to get on the board. I'm not quite sure how that works. Jericho or Linda, do you know how that works?
I believe you would determine whether or not people are interested in participating through reaching out unofficially, and then ask them to send a particular piece of paperwork, which you can find on the town website, which then they will then consider it on the next mat. I think there's a specific date it has to be done by, like no more than like 1 month or something after the paperwork goes in. Linda, you might actually be able to speak to this a little bit more directly than me.
I just unmuted. They have to advertise. And they have to advertise, I think, 2 weeks in a row or something like that. And
I was going to say that from the last meeting
here, then a lot of times they'll wait until they make the appointments in June. However, that only leaves like 4 or 5 of us left. We may have trouble with quorums. And so it's sort of imperative that they go ahead and advertise out of the rotation now to fill those seats. And then we all need to drum up people to apply. But they give you a deadline as to when you have to apply by. Then they have a public hearing, they introduce themselves, and then they vote at a subsequent public hearing. So there's a whole process here, but the sooner we get a letter to the selectmen I don't care what they call themselves, it's selectmen, to advertise, the better, because it's going to take them a while to get the advertisement going. So we need to do that immediately.
You know, I did ask Erica when I submitted my paperwork about how we could facilitate that, you know, knowing that, you know, they didn't even have Kendra's resignation, but so, yeah, we're down 3. I don't know who's going off at the next, you know, next June. I don't know who's off the board next June, but I think what they do is they have people fill people's terms. And then, but you know, so ask around. I've asked a few people. You know, I've asked a few people if they wanted to join. I think we should all cast out to people who would be good representatives and actually show up at meetings to work. There's a lot going on right now for seniors. So
when the town advertises this, where do they advertise it?
Any advertisements the town is required to do have to go to the Inquirer Mirror. I believe that's considered the
it's the paper of local circulation
record
law, but that would be the INM.
And I believe, yeah, it's 2. Arlene, you had something to add, but I believe it's two consecutive. All of the the ones we have to advertise anything are all 2 consecutive ad buys,
right?
Or more. And I think they have to be.
It says something like public notice on it.
I never read those when I see them.
The INM will know what to do, you know, as far as the ad is concerned from the town. They do it all the time. But I was just going to repeat what someone else had said already. I can't remember which one of you said it, but we do have to request the select board to run the ads consecutively for 2 weeks, and also put our thinking caps on to solicit new council members, like who would be good candidates for that, to apply to them. So
shall I take the job of contacting the town to get them to put this ad in?
Please.
It probably would be best coming from you.
Okay, I'll be glad to do that. And Allison, before you go officially, I want to thank you on behalf of all of us for all the service that you've done for the Council on Aging, which has been so over the top. I've never known anybody since I've been involved who has contributed as much as you have, which is so meaningful and will go on long after you've gone to Fiji.
I'm not going to Fiji.
We'll come back and see eventually that your work
I'm not going to Fiji. I mean, just so everybody knows, I'm not going to the Peace Corps. I was not medically cleared to go to Fiji, the Peace Corps. So I quickly pivoted, and instead of going away for 2 years plus, I'm going to take a sabbatical starting in Thailand. And I am going to travel Southeast Asia with my teaching English as a foreign language certificate, and just see how the other half of the world lives. So, you know, part of me is relieved that I'm not going to be gone for 2 years, because I'd miss my cats and my son immensely. But yeah, so I'm really psyched. I'm leaving on the 11th of January.
So just so everyone knows, she said, I'm going to miss cats first, then son. Just so everybody knows. I just want to make
you've been gone for a long time.
I know. I'm just giving you.
My cats have been with me for 15 years.
I'd rather be jealous of the cats than the purse. So we're good.
Okay,
good.
Well, Allison, my cousin did that in Korea. She's in her 70s now. She did it in Korea in her 60s, the English thing, and then she did it in China.
Yep.
She said it was a very rewarding experience, and you know, age is nothing over there.
Yep. No. I mean, they love their elders. But since I'm not going in with a teaching certificate, I'm going in on a tourist visa. I probably am not going to be able to work in Thailand, but at least I'll be able to, you know, employ the skills. You know, there's a middle school near where I'm going that will be. I can't wait to get in there. But anyway. Thank you. I will be back, and hopefully the island home will be built and the senior center will be done by the time I get back.
Wishful thinking.
Yeah.
But
Well,
Allison, you're going to leave some very, very big shoes to fill. I think we're going to need 2 people to fill your 1 vacancy.
good.
Truly, thank you so much for all you've done.
You're welcome. You're welcome.
Well, you can stay
Yes.
on and just do it remotely, you know.
No,
We
that
could
didn't work with
Zoom.
Kendra. It
We
would
will
be,
definitely.
oh, good. Well, I will be back and I can't wait to see what it looks like. I'll either love it or hate it.
Well, post your expeditions.
I will. Yeah, I'm figuring that out now, but I'll share.
Well, Merry Christmas and Happy New Year to everybody.
Thanks.
Thank you, everybody as well.
All righty.
Safe journey.
Did
Oh,
we
wait.
get it? Yeah, did we officially end
No.
the meeting? Okay.
No, I think we have to officially end it.
I move that we end the meeting.
And I
Bob will
second.
second it.
Okay, I have to go down the list again, guys, because
One
Linda's
last
here
time.
and she's gonna make me. Okay, say yes if you want to end the meeting. Allison,
Yes.
Bob,
Yes.
Arlene,
Yes.
Nancy,
Yes.
Linda,
Yes.
Mary Ann, yes. Okay, unanimous. Thank you, everybody.
All
And Thank you
righty.
especially.
Okay, bye.
Bye, kids.
Bye, everyone. Thank you very
Happy
much. Have a
holidays, everyone.
Yeah.
Thank
Happy
you,
holidays all.
everybody, too.
Bye.